Well, good afternoon, Sarah. Thank you for joining us to share your CHW or CHW ally story. We are so excited to have you here to share your journey as a CHW ally. So, first, could you start with telling us who you are?
Yeah, thank you so much for having me. I'm really excited to be here and to share. My name is Sarah Mills. I'm a registered dietitian, actually, and um, community nutrition educator, CHW ally, and just an advocate for healthy food access for everyone.
Awesome. What is it that you do? Tell us a little more about what you do.
Yeah, so currently I'm a program manager at Share Our Strength with their No Kid Hungry campaign. So we work a lot in communities, supporting food access for kids through strengthening different food programs, working with schools to get more children involved in, summer meal programs and school meal programs. And then I also work really closely with healthcare organizations. So I've worked with school-based health centers and clinics and hospitals on their food as medicine
Mm,
efforts. So really connecting their patients with healthy food and setting up programs like produce prescription.
okay, awesome. So, why does what you do matter?
Yeah, I think the connection between food and health is so important. When I was a community nutrition educator, I worked in communities around Metro Detroit, which is actually where I live. And I loved introducing people to new foods. I loved being able to talk to folks about, what was important to them about their health and how they wanted to get there and help them reach their goals. But it's it's not just about nutrition education. Like there's so much more to health,
Mhm.
and especially when it comes to food, and people need to be able to access and afford the healthy foods to be able to thrive and be their healthiest self. And so I really am passionate about the work that I do because I loved working one-on-one with folks and doing nutrition education, but if folks can't get the foods that they need, that's critical. So yeah.
Absolutely. Absolutely. Thank you, Sarah. Now, what is your CHW ally story? What brought you to this work?
Yeah, so as I mentioned, I've been doing some work with healthcare organizations as I've been working with the No Kid Hungry campaign. And almost every organization that I've worked with, there have been CHWs a part of that work because CHWs are critical. And so one thing that has really stood out for me is just how important CHWs are as the trusted messenger for families. Food programs are not easy to navigate. They're complex on purpose to
Mhm.
make it difficult for folks to be able to get access to the resources that they need. There's a lot of mistrust, and that's been heightened,
Mhm.
especially in the last few months and years. So, um, the to engage with someone who can really provide accurate information about programs to build trust with families. I just think CHWs are so important in being able to communicate that message. And so we are really looking forward to working more closely with
Mhm.
CHWs as we go forward with our work in healthcare.
Mm. Okay. So share with us what influenced you or how did you become a CHW ally?
Yeah, I got connected with the NASHWA, the National Association of Community Health Workers.
Okay.
And, we have been talking with them for a few months now about how we can work more closely together. And I think one thing that's really risen to the top is this, the messaging that community health workers can share with families about food programs. And so we'll be working really closely actually on a project with Nashua this coming year to really understand how we can help better equip community health workers to have those conversations with families about food programs. And also we as an organization want to uplift community
Yes.
health workers and that critical role that you all play. So we're also working on some different advocacy priorities around like funding for community health workers to ensure that that profession remains viable and that those
Mm.
folks can be available to families to provide that support.
Oh, thank you. Thank you, Sarah. And finally, if there's one message that you would like to share with community health workers and community health worker allies alike, what is that message you would like to leave them with?
I think I would say just that we see you
Mm,
and I am in awe of like the critical work that is done by community health workers every day. And I think in my role, I want to be a support and a voice and an advocate as much as I can for CHWs. And so, yeah, I think my message is that, like, I see you and you're doing an amazing work in communities, and families really need that work in order to be on that journey to reach their optimal health. So appreciate everything CHWs do.
thank you, Sarah. Thank you for your time. What an amazing, I mean, and thank you for being the first CHW
Oh, yeah.
ally to be on center stage and sharing your CHW ally story. We definitely appreciate you coming along, supporting, and helping to uplift and strengthen the CHW workforce.
Thank you for having me.